Most of our patients that we bring into SR3 are harbor seal pups, but our staff and our facility is fully capable of rehabilitating and caring for larger animals like adult harbor seals.
We recently had 2 adult harbor seals strand in the Puget Sound region. We responded to a young adult male harbor seal. This animal was on a neighborhood beach in thin body condition, really lethargic.
Michelle and I were able to walk up close enough to it. It barely responded to our presence, and we were able to put a net over it, bring it into a carrier, and take it into rehab. The fact that it didn't respond much at all to our presence was a little alarming and gave us the indication that it was probably doing a little worse than we thought it was when we first arrived there.
Just a few hours after he came into care, he actually had a seizure and passed away. His blood work was indicative of really severe infection. So we performed a necropsy on this animal, and we found a large softball-sized mass in his abdomen, so it was just behind his kidneys. And that mass was actually an abscess, so it was full of inflammatory cells and pus, essentially, which could certainly explain his cause of death. So this animal was an adult female harbor seal, was in really thin body condition, and also had visible wounds on her front flippers and her torso. While she was here, we treated her specifically for those wounds because they were fairly significant. So we made sure that she got antibiotics to help with any sort of infection, as well as pain medications to keep her comfortable. So she was in care for about 9 days. Unfortunately, throughout that time, her clinical condition declined. So we were concerned that she was becoming septic, which is essentially systemic infection due to the severity of those wounds. We elected to humanely euthanize her. And her necropsy also showed that she had pretty severe infection of those underlying skeletal muscle layers because of the wounds that she had on her chest as well as her front flippers.
We learn a lot from the animals that we treat, and while we want most of those animals to get a second chance out in the wild, there's a lot that we can learn from animals that don't make it, either in how they respond to their treatment or their care, or what we can learn from them that may have been underlying causes that led to them coming in the first place.
So it's really important to respond to not only just pups, but animals of all species and age classes that are stranded in Washington, because it really gives us a more holistic view of the population. And being able to study marine mammals in a rehabilitation setting kind of gives us this unique opportunity to learn more about animals up close that we may not actually have the opportunity to learn about otherwise. And by determining the cause of death or the cause of stranding, especially in these animals that don't make it, it really provides us with more information on what's going on in the population, as well as insight into what's going on in the health of our ocean.